The behavioral health system in this country is broken. The evidence is stunning. More suicides every year, overflowing jails and prisons, an opioid and heroin epidemic, lost jobs and unemployment. But what if we need mental health or addiction treatment? The system and services we have now are really hard to navigate, too often unhelpful and frequently frustrating. There are better ways, actual answers. We call this the system we need. Just as there's not one cause to most problems, there's never just one solution. The system we need is made up of many good solutions. We can start making them happen now. Just like we go to the doctor every year to get a physical checkup, to take our blood pressure, listen to our lungs, and examine our reflexes to keep our bodies healthy. We also need to get a checkup from the neck up to keep our brains healthy. Our doctors can measure our mental health, for example, using a simple evidence-based questionnaire. They can use our patient feedback to assess for depression and to tell whether prescribed treatment is working. Treating the whole person means from head to toe. In the system we need, screening and measurement-based care for mental illness and addiction is a must-have. That way we can get people help they need earlier. And when treatments aren't working, we can change them so that they do. Recognize that depression, like diabetes, needs to be detected, monitored, and treated. When we care for the body and the brain, we can treat disorders early and more effectively. And that's a really important part of the system we need. We all know we need to exercise to keep our bodies in shape, but what about our brains? Mindfulness is a type of brain-building exercise, proven to enhance cognitive functioning like attention, focus, and memory from early childhood through adulthood. Many companies have invested in mindfulness training for their employees to keep them in tip-top condition. This is just one way brain fitness can transform our lives. When we put brain fitness, social emotional learning, and trauma-informed care in the classroom, and give youth the support they need, early and where they are, we ensure our kids are ready to learn and succeed, and that everyone can increase their resilience and manage stress throughout their life. Technology is an important ingredient to making the whole system work at its best. Remember this? This was cutting edge until it wasn't. But now we have this and this. These are also ways to help us manage our brain health. Technology can help deliver mental health and addiction services to people who have a hard time getting to care, providing decision support to clinicians so they do what works. Adopting these technologies now can help us disseminate and accelerate treatment, reduce healthcare costs, and build the system we need. The system we have today is dysfunctional. Care happens within silos. We see one type of clinical provider and then another, and nobody's talking to one another, and information is lost. Sadly, our health pays the price, especially when it comes to mental health and addiction. By rethinking the way we deliver the proven treatments we have, we can make great strides to improve patient care. That means delivering treatments based on our own needs. When we need to care for serious mental illness, we know that using a coordinated, specialized team of care is the best approach. At the same time, we can treat many behavioral health conditions effectively in primary care offices, coordinating with our specialty system only when it is needed. With integrated delivery, and by delivering treatments that are customized to the type of condition, we can more effectively and efficiently care for patients. When all parts of the system work together in coordination with one another, patients do better, feel they're better served, and money is saved. Even though we've been through a lot on our journey already, for many, the journey is just beginning. As they discover when they try to get insurance coverage for their behavioral health treatment. Even if you have health insurance, health insurers and other payers too often deny payments for needed services. But there's a law on the books that is meant to ensure that mental health and addiction problems are covered the same way as physical health problems. It's called Parity. We may have the needed clinical components of the system we need, offering proven treatments with effective outcomes. But if parity is not delivered to make treatment accessible and affordable, no one gets better. In the system we need, the mental health parity law is not only fully implemented, it is fully enforced. We need medical management practices that are similar to other health conditions, as required by federal law. Then we can ensure that the different parts of our community services and every person can get quality behavioral health care, maintain brain health and fitness, have access to the latest technologies in a system that is truly integrated. This would create better patient outcomes, improvements in education, increased worker productivity, and a better approach to our criminal justice system. We can only achieve the system we need when we build it together.